Now, when it comes to the immune system, which is the system in your body that's there to fight off foreign substances or pathogens or cancer cells, your body actually has two different branches of immune system. The first branch is the innate immunity, and the second branch is adaptive immunity. And there's some big differences between the two. First of all, your innate immune system is inborn, which means you're basically born with this system. It just comes with the body, and from birth, even as a baby, you have an innate immune system ready to go. For adaptive immunity, though, this one develops throughout life. And actually, in newborn babies, the adaptive immune system hasn't been developed yet. It's very weak, so it takes time to develop this adaptive immunity. For innate immunity, the responses, the immune responses are non-specific, meaning the immune system in the innate immunity will respond to anything that looks foreign. So if there's bacteria, viruses, cancer, anything that just looks foreign or not normal, the innate immunity will attack it. Whereas the adaptive immunity is very specific, and it's specifically looking for something called antigens. Antigens, I like to say, these are the bad guys. Anything that's foreign and dangerous is an antigen. And antigens are just small pieces, small fragments of a pathogen. So it's not the whole bacteria or the whole virus, but it's just like a little fragment, like a little piece of the bacteria or the virus. So one bacteria can have many, many antigens on its surface, but the adaptive immunity is very specific to recognizing only one of them. Same thing with viruses. Lastly, your innate immunity, it's basically always present. So it's there from birth, it's not specific, and it's constantly working all the time. Whereas your adaptive immunity, it takes time to develop, it's very specific, and it has something called memory, meaning when there's a pathogen in your body, it will remember it, and it'll get even stronger the next time that pathogen enters the body. This is why we often only get sick with the same pathogen once, because our adaptive immunity can remember this pathogen and fight it even stronger the next time it sees it. Now, this table shows all the different types of white blood cells, and you can see there are many, 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 many different types of white blood cells. And we're going to briefly talk about every single one of these, but this table is very helpful in helping you remember the name of the cell and its function. So you might want to copy or print this table out so you can use it during the exam, because it'll be really helpful. So first, let's go through quickly the different components of the innate immune system. So the inborn, non-specific, always there with you throughout your life immunity. So the first component of the innate immunity is the barriers to entry. So this is basically anything in your body that will prevent the entry of a foreign invader or pathogen. And there's three main components of things that'll prevent entry of pathogens. The first is your skin, your skin that surrounds your body. This is a major barrier for pathogens. The second is your mucous membranes. Mucous membranes are basically your internal skin. So preventing things from getting in through your digestive tract, respiratory tract, urogenital tract. The third major barrier to entry is the good bacteria in your body. So your body is coated with a lot of very, very good bacteria that are helping to outcompete any of these pathogens. So how does your skin block entry of pathogens? First of all, it's impossible for bacteria or viruses to penetrate through normal skin. The only way that bacteria or viruses can enter through skin is if there's some type of open wound. So if you get a cut or a splinter, or your skin's cracked, very dry, or like an insect bite, but otherwise it's really not possible for bacteria to just dig through your skin. And the reason that bacteria and viruses can't just enter through your skin is because your skin is so thick. There are so many layers to your skin. The outer layer is the epidermis, The epidermis is constantly shedding. As the epidermis sheds, it also sheds any pathogens that may be residing on the outside. Then the lower layer is the dermis. And in the dermis, you have a lot of glands like sweat glands. And when you sweat, your sweat is very salty. And bacteria do not like that saltiness of sweat. So that's one natural way your body eliminates bacteria on your skin is through sweat. Also, you have oil glands. All right, so your oil glands are another natural barrier to keep pathogens away. So your skin is the first natural barrier. The second is what's called your mucous membranes. This is basically your internal skin, okay? Anything from your mouth, your respiratory tract, digestive tract, to all the way to the urogenital tract. Okay, so these are the internal skin. Now, pathogens are much more likely to get in through this. Get in through food or in through air or even your eye, like rubbing your eye. Okay, but there are still some natural antimicrobial properties of these mucous membranes. For example, your stomach acid. Your stomach acid is a very, very low pH that'll kill a lot of the bacteria that are in your food before they travel anywhere else in your body. So that's really important. Also, as you know, your respiratory tract is lined with cilia, and the cilia help brush and sweep bacteria away from your lungs. There are also natural secretions, natural secretions such as saliva and mucus that will help trap pathogens and keep them away from your body. Now, the second class of innate immunity are called phagocytes. Now, sometimes a bacteria or a virus makes its way. Okay, so here's a bacterial pathogen. It could either maybe penetrate the skin or penetrate mucous membranes, and it can enter the body. Now, the first thing that's going to happen right away if a pathogen gets in your body, our special white blood cells called phagocytes are going to come in and engulf the pathogen. Now, there's two main types of phagocytes. The first type is called a macrophage, and the second type is called a neutrophil. Macrophages are kind of just hanging around in special sites of the body. So they're waiting in the body for a pathogen. Macrophages are larger and they are also a bit weaker. But the good thing about macrophages is they can be reused many times. Neutrophils, on the other hand, neutrophils are circulating in your blood and they're looking out for any pathogens that get in your blood. Neutrophils are very strong. They're much stronger than macrophages. However, they can only be used one time and that's it. They're dead. All right, so here's how phagocytes work. Here is the phagocyte, this big blue thing. I like to kind of draw the phagocyte like a Pac-Man. Do you guys know what Pac-Man is? Pac-Man is like this game that they had in the 80s, like this guy who chomps up and eats like fruits. So this week's code word is Pac-Man. Hey, you guys, if you have never played Pac-Man before, you should try to find it online and play it. It's addicting. It's fun. All right, Pac-Man. So, Pac-Man is looking out for any bacteria that have entered the body. And when it finds these bacteria, it's going to engulf them. And as soon as those bacteria get into the little macrophage or the neutrophil, they're going to chop them all up into little pieces, degrade it. And then they spit out any remaining junk. And when they spit this out, this is called exocytosis. Okay, so that's what phagocytes do. They're looking around in the body for any bacteria, viruses. They're going to chomp them all up into little pieces, and then they're going to spit out whatever debris. And this helps kill any pathogens in the body. The third innate immune response is the inflammatory response, also often called inflammation. Okay, the purpose of inflammation is to block off pathogens so that they can't spread around in your body. So it's going to block them off and then it's going to destroy them before they can affect you in any way. So here's a nice example, okay? So this person has got a sharp object stabbed into their skin. Okay, like a knife, if you've ever stabbed yourself or cut yourself with a knife or with a splinter or something. There's definitely some bacteria, which is these green things, that have now entered into the skin, okay? So during the inflammatory response, the first thing that's going to happen is this big blue guy here, this is a macrophage. Macrophage is going to call in for some help because this macrophage can only eat a couple of these little bacteria at a time. So it's going to call in for help. And what's going to happen is here's a blood vessel that's near the site of damage. The blood vessel is going to swell up. All right, so that's one of the signs of inflammation is you get some swelling. And another sign is you get some redness. All right, and this redness is because these blood vessels are swelling up. And then you start to feel some heat because your skin's going to feel a little hot at the site where the blood vessel's coming out. And then lastly, because this macrophage is releasing these chemical signals, this leads to pain. Okay, so the cardinal signs of inflammation are always swelling, redness, heat, and pain. That's how you know your body's going through an inflammatory response. So now, more macrophages and neutrophils can leave the blood vessel and travel to the site where those bacteria are, and then they can all chomp up and kill that bacteria and get rid of it before it causes an infection in your body. So that's the third innate immune response. The final and fourth innate immune response are these special cells called natural killer cells, or often abbreviated NK cells. Natural killer cells have two jobs. Their first job is to kill cancer cells. So most cancers in the body get destroyed immediately by natural killer cells before anybody even knows that there's a cancer cell there. They're very, very, very strong and efficient at killing cancer. Their second job is to kill any cells that are infected with viruses. So kill virally infected cells. So here's how this works. When the natural killer cell recognizes either a cancer cell or a cell that has some viruses in it, like this one, it will hook up to that cell that's sick and it'll secrete these chemicals. And I always call these chemicals the death package. All right, so they're secreting this death package to come in, and now the cell that is infected will be killed by apoptosis. So this death package will signal apoptosis, and the sick cell will die.